So one of the questions I get a lot after the first couple times I see somebody is, is yoga good for me? And so I know what I tell my patients, but I'm sure it's exactly the same that is what you tell them. But I'll just let you kind of say what you're going to say.
Okay. Yeah, and then we'll compare and see if it's the same. So if somebody comes in and says, hey, I've got this back problem, and I know we talked about everything we talked about, but is yoga good for me? And then my usual response is, well, it depends on the type of problem that you have. So if the patient has a particular directional preference, and so go back into our YouTube videos and search directional preference so you can understand what that is. But in brief, a directional preference is a direction of movement that we can move, and we'll just take, for example, somebody's spine. If we can move your spine in some direction and that creates some sort of positive benefit, like very rapidly, right in front of our eyes almost,
so
in either symptoms or, so in either symptoms or mechanics or function, right? Things are better, like very rapidly. So if the patient has a directional preference that's rapidly identifiable, then I would say we have to follow that directional preference first before we just start going into yoga, because yoga tends to take people into multiple different directions of movement, and if they have a directional preference, we have to honor that particular directional preference. So let's just say that it's back bending, which is the most prevalent kind of directional preference for the spine. If the patient has a back bending directional preference, then forward bending will worsen their condition, will be unhelpful, and we have to stay back bending for a period of time. I may have them work a little bit of forward bending into the mix, depending on how irritable the condition is. But if the condition isn't too irritable, and by forward bending we don't make their baseline symptoms significantly worse, then I'll say, we'll do primarily back bending movements and keep track of your symptoms, your symptoms and your ability to move and your function, and make sure those are improving. And we'll avoid poses in yoga that are forward bending, just for now type of thing. And it's not always like we'll avoid it all the time. Just avoid forward bending. That's like the worst thing we can give a patient, right? Is to say, if it hurts, just don't ever do it again. Well, no, that's not treatment and that's not healing, right? So I guess a short answer is yes, yoga is okay, dependent on your kind of problem.
Yeah, I agree.
What do you say?
Well, that's basically what I tell them. And personally, I play with yoga periodically, and just because I want to see what people are talking about, and what I've found and what I've discussed with a lot of patients that I see when they ask me that question is like, how much forward bending do you do in yoga? And then I say, personally, when I play with it, I find that there's a lot of bending forward, and it doesn't really seem to balance out as much backward. So again, if somebody has a problem with, say, like Ryan was saying, is that their preference is to move backwards, and we're seeing improved range of motion, and the symptoms are getting less and less and less, then I will say, go ahead and do the yoga, because I want you to move, but again, limit your forward bending for right now, because we already know that forward bending bothers you. You can go move and do stuff, just modify how you're doing some of those activities, but keep moving. And again, check your range of motion periodically during the session. Make sure you're not losing your ability to go backwards, because if you are, then you're probably bending more than you think. And then watch your symptoms. If you start seeing something starting to spread out a little bit more, it's getting a little bit worse, and your motion gets stiff, you got to back off and just go right after your exercise again. Yeah.
So it's self-assessment, right? So it's stuff that we teach patients every day is to self-assess. Why do we do that? So that they know whether what we're doing is helpful or unhelpful. And then if something is if an activity makes the condition worse, then they're the first ones to know, and they can stop it very quickly. The reaction time is very fast, and it prevents the process, or it prevents the worsening of the condition from snowballing, going over and over again. So I agree. So if the patient is self-assessing and they have a particular direction of movement that we know makes them better, then we can start reintroducing a bit of the opposite direction, as long as they self-assess and their baselines don't worsen. Exactly. Because that's reincorporating daily life stuff, right?
And they learn how to use what we teach them in just the daily process of life, because we're all living, we all get stuff. I do this all the time. I still get stuff, but I kind of know instinctively, okay, I got to check these different things, and okay, that's motion's feeling obstructed. I got to do my thing, restore that motion, because if I can restore my motion right away, I know I can control any symptom onset.
Yeah, yeah. So and it's not that we're singling out yoga because because there's some sort of inherent negative quality to it or anything like that. That's not the point. It's just a very frequently asked question that we get. It's, can I do yoga with this particular condition? And for all the reasons we just stated, then yeah, you can, but it depends. And let's figure this out together, and you can self-assess along the way and determine if this particular pose is making your condition better or worse, or if it's helpful, because we want to reincorporate normal daily stuff as quickly as we possibly can. Because I get this too, where somebody's been to another clinician and they said, well, if this hurts, just don't do that anymore, right? And that's not very helpful advice, because sometimes there are conditions where we need to go into the stiffness or the soreness in order to get it better. So in that case, then yeah, yoga that goes into the direction of the stiffness would be helpful, but we wouldn't know that unless we evaluate it first, right?
And that can happen with any exercise routine you're doing.
Yeah.
Right? So we don't want to create any fear about don't do this, because like Ryan's saying, over a period of time, once we can get the problem reduced and stabilized, then you go back into able to do those activities and not have a fear. However, you always have the ability to assess yourself pre and post activity, whether it's yoga or Pilates, it doesn't matter. And then you can make sure that you're keeping everything in a good position, and you're keeping yourself assessed, and you're keeping your range of motion. If you keep your range of motion, then you're going to be able to maintain a much reduced symptom frequency and intensity over time.
Yeah, I agree. Prove to yourself whether you're getting better or worse. You're doing something that's helpful or unhelpful.
Right.
Yeah, it's just proof.
So what does the research say about yoga?
So the research, we were both just involved in a low back pain clinical practice guideline with the North American Spine Society, and it was immense. It reviewed all literature from as far back as we could run it up to the present date as of there's a specific date within the guideline where we pulled all the articles, so it was up to that date. All the literature states that movement is good. Yoga falls under that genre of exercise and movement, but it's not superior to other forms of exercise. So it's not better than cardiovascular training, and it's not better than resistance training or generalized stretching, right? So the overall takeaway, if we just look at that, it says movement is good. But from other research that we pay attention to, and even in our clinical practice, we understand that there are specific movements that are even better than just simply moving. There are very specific movements that we can use that will change the big three baselines, right? Symptom baselines, mechanic baselines, how well you're moving, and your functional baselines. How well do you go from sit to stand? How well can you roll in bed? Those types of things. And we can identify those with a simple, reliable mechanical assessment and determine if there is one direction of movements that's much better than just moving. So, and there are times when just to move, we determine that as well, right? But we have to go through a mechanical process in order to determine that a particular individual requires generalized movement, or do they require very specific movement first and then generalized movement after that.
Exactly.
So yeah, literature says movement is good, but specific movement is better.